Well, so while Keith is doing that, maybe I can get started and we can save a little bit of time. Don't
Yes.
share the speaker notes, Keith. It's
No,
giving
no,
away
I'm
all the
gonna put them.
secrets.
They're gonna know what you're gonna
Um,
say. Okay, how's that?
nope,
Uh,
those are the speaker notes.
it's
So you
the
have,
there we
there you
go.
go.
Much
We did
better.
it.
Yay.
All
Okay.
right.
Nice work, Keith.
6 minutes
Great
in.
job,
I
Just like we
appreciate
planned
it.
it. Okay. Sorry about that,
Thank
folks.
you. Thank you so much. I appreciate that, Keith. Thank you for running it.
Sure.
Um, And Keith is also going to speak in a few minutes. And so we are so glad that he is here. Thank you, Amy. Thank you, Hillary. And thank you to everybody who is joining today. I really am thrilled that you're here to talk about gaining sort of a competitive edge in your grant writing. Again, you're also going to be hearing from Keith, the senior analyst with Stroudwater, who's going to tap in during that data section and talk you through one of Stroudwater's, what I think is most impactful analytics efforts to date, which is that congressional dashboard. And lastly, there should be something for everyone today, starting with tech problems, but moving from beginner to advanced writer. I personally think it's very important as a grant writer that we help those who are starting out and also help push those along who are more seasoned. So my goal was to try to sprinkle a little something in that covers that range, and I hope that you can appreciate that. So with that, we've got a lot of ground to cover today, so let's dish it up. If you want to move ahead. At first, I want to start with just a single idea that separates out maybe what higher performing grant teams have versus what those who are lower performers are. And it's not a note about writing skill. It's that grant writing is not about filling out applications. It's about building a defensible case for investment in your community. So it's really not uncommon at all that you see grant teams, especially the smaller ones, and especially the ones that are wearing 1,000 different hats, approach grants sort of like a form to be completed. You might get a notice of funding offer or an RFP. You answer the questions, you hit submit, you wait, you're probably disappointed, you rinse, you recycle, you repeat. That's filling out applications, and that's just simply not what wins. What ends up winning is when a reviewer opens your submission and they start to think like, okay, this organization knows exactly what problem they're solving, exactly who it affects, exactly what they're going to do about it, and they know exactly why it will work. They don't have to talk themselves into funding you. You've already made the case for them. They just have to go in and defend it in a committee, and that is exactly what you want. So it's that shift from applicant to advocate. That's what today is about. And much of the material that we're going to cover is going to flow from that source. So Keith, if you want to move ahead, thank you. Before we begin, I want you to think of this process sort of as a series of concrete capabilities. The first is our prioritize, and this is really going to be the focus of our targeting, okay? It's how we identify the grant opportunities that are actually worth pursuing. And just as importantly, how to walk away from the ones that aren't worth pursuing. Girl, don't give that man your time because time spent on a low fit grant is time I promise you that you are not spending on a grant that you could actually win. The second is going to be that quantify, and that's where our data really comes in. That's how we're going to use our rural specific data. It's your own data, it's your public data, it's your federal designation data. You're going to use it to build that need statement that reviewers don't want to dismiss. It's going to be used to build that statement that they're going to remember. And most importantly, it's going to be used to build the one that they're going to defend. The last is at persuade, and we're going to spend some real time here on narrative. It's going to be on the actual craft of writing a proposal that sort of moves the reviewer from that idea of like, well, like this is interesting to I'm going to go in and I'm going to fight for this in committee. You can go forward. The first thing we're going to start with is our landscape, right? We're going to start by making a case that we are, in so many ways, right now, sitting on one of the strongest grant stories in American healthcare. And I don't say that as like a pep talk, I say it as a strategic fact. Move ahead. So let's take a look at the landscape that we're currently operating in. So we've got 432 rural hospitals that are currently considered vulnerable to closure, and that's across 38 states in 2025. So it's not a handful, right? Like not a few outliers. That's 432. And about half of rural hospitals are operating on negative margins. 57% of US health professional shortage areas, the federal designations that mark where care is hardest to access, those are rural. And I noticed that there's a workforce gap that almost feels like elegant in its starkness, and that's that 20% of Americans live in rural communities, but only 10% of physicians practice there. So you're serving twice the population with half the resources. And we're talking about this at the top of this session on grant writing because this is your context. This is the landscape. You walk into every application and you carry this with you. And the funders, federal, foundation, corporate giving, they're increasingly looking for organizations that they find are working at this intersection of like access and equity and urgency. And that's you, and that's every person that's attending today. And here's what I can tell you from working with rural hospitals across the country. It's that the story, it's already there. The gap that most organizations have, it's not the story itself, it's knowing how to translate what they're living every day into language that's going to make a funder's case for them. That's a learnable skill, and that's what you're here to learn today. All right, so the first thing we're going to do, let's see if we can get this poll to work. And it is. So I want to know where you're starting from. I want to know from you, how many grant opportunities is your organization currently tracking? Okay. All right. I see a lot of 1 to 3s, 4 to 7s, 8 to 12s. And if it's 0, that's okay. You can count yourself in the 1 to 3. That's all right. Okay. A lot of 1 to 3s, followed by 4 to 7, then 8 to 12. Okay. So, if you're in the 1 to 3 range, I think that's great. That's in no way any sort of failure. I think that's excellent. And that might be exactly where you should be if those are the right 3. Because volume is not the goal. Volume should never be the goal. And I'll say it again because it runs counter to what so many teams are taught. Volume will never be the goal. Strategic fit is your goal, and strategic fit should always be your goal. I didn't see anybody say 13 plus in there, but let's say you find yourself knocking on that door. I want you to ask yourself honestly, if you start finding yourself in that situation, are all of those things real pursuits or are they probably aspirational? You have to remember there's such a real cost to tracking opportunities that you're just never going to write. It takes up energy, it takes up space, and it takes up time in your pipeline that belongs to something that you could actually be winning. So let's move ahead. Before we get into targeting, let's make sure we're all oriented to the same map. It's important that we're starting in the same place. I'm sure you all know this, but let's refresh it. There are 3 primary funder channels in rural healthcare grants, and they are not the same. They're nothing alike at all. You've got your government, your HRSA, CMS, USDA, SMAHA. These are big fish. They're your larger awards. They're your longer cycles, but they are also the strictest compliance. However, you're talking 150K to 300K annually from a program like maybe HRSA Outreach. And those state level programs can go into the hundreds of millions, which is a really big deal. But you are playing by very specific rules, okay? Formatting errors can disqualify you, not weak content, not a mediocre evaluation plan. Formatting errors. That's a bummer. That is a hard bummer after you've put all that work in. If you're not already using one, when it comes to a government grant, you'll need a logic model. And that's something that we're going to dive into later in this session. You're going to need a sustainability narrative. I got you covered. And from the time that that notice of funding drops to when awards go out, you need to be prepared that you're typically looking at something like 6 to 9 months. Let's move on to foundation, right? You've got your Robert Wood Johnson, your Helmsley, your regional health conversion foundations, community foundations. These are relationship driven and mission aligned. If you are not strong at building relationships, that is something that you want to get good at. These are the foundations. They care about equity. They care about innovative models. They care about what you're learning as much as what you're doing. Awards are typically going to range from 25K to several million. But the key insight here is that cultivation matters as much as the proposal itself. So out of all three of these, this is the one where those relationships are going to make or break your chances, right? The winning applicants are almost always in some form of relationship with the program staff long before they hit submit, like on that application. And the last in the bunch is that corporate. And I tell people this all the time. Don't sleep on corporate grants. We are seeing more and more and more and more interest in rural healthcare from the corporate giving side. Don't sleep on it. It is important that you look for these and that if you find one that's a strategic fit, you go for it. These are your health systems, your payers, your pharma companies, regional employers. Yes, they are smaller awards, but they're faster timelines, right? They are more focused on things like brand alignment and community visibility, but they can be anywhere from 5K to 250K, which is no small amount. Often they have in-kind components, which is great, and they move more quickly than the other two channels. So the takeaway here is that different channels reward entirely different strategies. Okay, a foundation does not want your federal logic model, and a federal agency does not care about your corporate partner's branding story. You have to know which game you're in because it shapes everything that you write. We'll move on. So here's how we're going to organize the rest of this session. It's going to be structured into three blocks of high performing grant strategy. That first is that targeting, right opportunity, right fit. It's not uncommon to see teams chasing as many notice of fundings or RFPs that they can find, but consistently winning teams ruthlessly disqualify and they concentrate their efforts on the 15 to 20% of opportunities that they actually have a shot at winning. That second block, that's going to be our data. That's our rural specific reviewer ready. Generic statistics are always going to lose. They're just not going to get you where you want to be. That hyper local data paired with credible benchmarks, that's what's going to separate you from a fundable proposal to a forgettable one. The last is our narrative, that logic plus emotion, and that equals your defensible case. Reviewers are going to fund stories that are backed by numbers and numbers that are backed by stories, okay? Reviewers fund stories that are backed by numbers and numbers that are backed by stories, and there will never be one without the other. Move on. So let's get into the targeting. We're going to identify some high probability funding opportunities, and we're going to learn how to walk away from the rest. Go on. We talked about the three funder universities at the highest level. But we want to get a little bit more specific about what each one actually requires because this is where you can oftentimes go wrong. When you're working on the government grants, you're being evaluated by federal reviewers that are scoring you against an intensely strict rubric. There is no room for error or there's no room for flexibility there. That strict notice of funding compliance it's just not optional at all. As I said, you can get disqualified over something like margin formatting. Imagine putting all that work in and then you're disqualified over something like that. Um, Logic models, evaluation plans, sustainability narratives, those are your table stakes. You absolutely must have them. A timeline for a government grant is very long, but the awards are substantial. And the teams that win consistently at these ones are the ones who treat this like the procedural, evidence-driven process that it is, and they don't treat it like a storytelling exercise. Those foundation grants, again, that relationship always precedes the proposal. The successful foundation applicants always have some form of contact with that program staff long before they submit. These funders, they want your theory of change. They want equity embedded throughout. They don't want it as an afterthought in the final section. They're explicitly open to piloting new models. That is a genuine competitive advantage for cause who are innovating out of necessity every day. And those corporate grants, fast moving, relationship adjacent, ROI aware. The company giving that money is thinking about what it does for their community reputation, their employee engagement. They're thinking about what it does for their brand. And that's not cynical, okay? It's just the truth. That's just how it is. Once you understand that and once you accept that, you can write directly to it and you will be happily surprised. So move on. So if you aren't already using an internal scorecard, I hope after today you will be. In my experience, this scorecard alone can really change how a person or team will allocate their time. Okay, the teams I see winning consistently, again, you are ruthless in this process. The teams that aren't tend to burn out. You've got 6 questions here, and the goal is, and the whole point of it is that you ask every single one before you decide to pursue an opportunity. And as I'm going through this, I want you to think about the current top pursuit that you or your organization are pursuing. So have it front of mind, right? As we walk through this, be thinking about that pursuit. Okay. The first is your mission alignment. Does the funder's stated priority match a strategic goal you'd pursue anyway, even without the grant? So if you're bending your work to fit their priorities rather than the other way around, that's a structural mismatch. And that is going to end up showing in your proposal every single time. The second is that geographic eligibility. Do your service areas, county designations, and HPSA scores actually meet the criteria? You need to read that eligibility section not once, not twice, 3 times, 4 times, 5 times, because that one question here, it's just going to eliminate a surprising number of opportunities before you've spent any amount of time on them. The third is that award size. Is the typical award at least equal to the staff hours required to apply and administer? Because a $10,000 grant that requires like 80 hours to write and 40 hours a year to report on, that's not a $10,000 grant. That's a net loss. Teams skip this calculation because they get really excited about the opportunity and they're not actually thinking through the math on that. You will save yourself so much time and frustration if you work that in. Fourth is your compensation density. How many awards are given against how many applicants? You want to avoid a sub 5 acceptance rate unless you have a genuine inside edge, which would be something like prior funding relationship, existing data advantage, or maybe like a consortium that's been funded in the program before. We have 2 more. The fifth is match and sustainability. Can you credibly fund the match? Can you operate the program without it after the grant ends? You have to remember, reviewers have seen hundreds of sustainability plans, and they know in a heartbeat the difference between a real plan and optimistic language that's kind of like dressed up like a plan. The last one is that reviewer signal. Have you or a close peer organization been funded before? Have program staff engaged with your team? Prior contact, it's not required, but it really is like a meaningful sort of competitive signal. So the rule is 4 out of 6 yes answers, you heavily want to consider pursuing it. 3 or fewer, you heavily want to consider passing on it. But you also want to document why. So your team doesn't revisit the same conversation 6 months later when the next cycle opens. So we go on. So let's put this to work in our next poll. I asked you to, as we were going through that, to be thinking about your top pursuit. So we're going to run it through the scorecard. How would that top pursuit score if you think back to it? What do we have here? Strong fit. That's great. Not sure yet. That's fair. That's fair. Strong fit. I love to see that. That's very exciting. Strong fit, borderline fit. Okay. So here's what I wanna offer you. Um, and for those of you who are saying not sure yet, I think that's probably one of the most useful answers you could probably give because it means that that scorecard, if you utilize it, that's going to save you some real time. So you want to take it back and you want to run it through your pipeline when you have some time. And we do have it at the end of this presentation. I have a little blank one for you to take. If many on here, I see you saying borderline, that's worth sitting with, right? That question, it can move you to any of the 6 criteria. If you can move those criteria to a yes, then you've got something to work with here. Sometimes the answer is a yes on those questions, sometimes the answer is a no. And you might find after you spend a little more time with it that passing on it might be the right call. I love that we're seeing some strong fits here. That's a really good sign, and it's definitely worth asking whether the other opportunities in your pipeline score as well, or whether this one is the outlier that you think you should be concentrating on. So let's go on. So here's something,
There you go.
sorry, here's something that consistently surprises teams when they first see it, or they can if this is the first time you're seeing it. Really successful grant teams or in really successful grant individuals, the ones that often report out like a 65%, 85% win rate. They spend roughly 3 times more on strategy and discovery than reactive teams do. And they spend significantly less time on writing and drafting. And if you're just getting started with this, that feels so counterintuitive because the grant, ultimately, it's a written document, right? So why would you spend less time writing? Well, it's because you've done the upstream work, right? When you've identified the right opportunity, when you've built your data package, when you've cultivated the program officer relationship, when you've clarified your theory of change, writing just becomes assembly, right? You're not discovering what you think while you write. You already know. You're just assembling it into the right order. So I want to be super transparent with you. I came into grant writing with a very strong and you could consider successful background as a creative writer. I had won awards and like cash prizes, and I thought I had it in the bag. I thought I was so special. Wrong. Could not have been more wrong. Wrong, false. What a joke. I could not have failed at literally anything faster or more spectacularly than I did walking into a grant writing situation thinking it was about writing. It's just not true. I had to learn that it was about systems. I had to learn that it was about process. I had to learn that it was about strategy. And I had to learn that it was about putting those components together. That was a tough one. And I tell you this because reactive teams often skip to the front and they try to compensate in the back end. They write fast, they revise constantly, they're exhausted, and they end up losing more than they win, which is, again, such a bummer. Okay. The shift is structural, it's not stylistic. You want to plan first and you want to write second. So we move on. All right, let's dive into some data. And one core idea for this section, okay, is that the thing I want you to remember is that your numbers, okay, need to do more than exist, okay? Your numbers need to work. W-O-R-K, W-E-R-K. Those numbers need to work in every part of your application. Let's move on. So, what I want you to take from the idea of this stack is so what I want you to take from this is the idea that this is like a stack. So each layer answers a question that the reviewer is already asking, but in order. So layers 1 and 2, these are about credibility, okay? Your outcome benchmarks show your numbers hold up against a standard that a reviewer can defend. Your evidence base shows the intervention itself has worked somewhere before. So it ends up that your theory of change, it's not going to read as theoretical. Layers 3 and 4 bring it home, right? Population and equity data name who is affected and where the disparities concentrate, specifically, not in the abstract, right? Your local service data proves it's happening in your own community. Layer 5, those designations, interestingly, they quietly sort of end up doing the most work. They prove your role in the exact language that like a skilled or seasoned reviewer is trained to scan for. You do not want to bury that in an appendix. You do not. You want to lead with that. So if there's a single layer in here that's worth committing to memory, it's probably layer 4. Your own EHR and claims data. It's the only layer that has no other applicant in the country that can replicate what you can provide, right? Because anyone can cite CDC places, but no one else has like your no-show rate, your transfer log, your wait times. So that is not a footnote, okay? It's a fingerprint, all right? And you absolutely need to learn to build from it. So we go on. And this is where Keith is going to step in for a minute and talk to you about the Stroudwater Congressional Dashboard.
Right. Thanks, Jolene. So some of those sources that Jolene had put in that prior slide included Stroudwater. So what Stroudwater did in 2024, at the request of NRHA and NOSOR, was to put together a dashboard looking at NRHA's pillars of um, infrastructure, workforce, and equity, and using that as an advocacy, mostly on Capitol Hill, to highlight the impact of rural in our country. So this is a dashboard that's at the congressional district level for all states. But since then, we've been adding and adding more data to that, more metrics, including a lot of the other secondary data sources that were on that prior slide, the CDC Places data, Robert Wood Johnson, and other public sources. So this is all public data that's put into a dashboard that helps you to pull the information that you want. We realized that a lot of people were using it for grant writing, so that's why it's included here. The link is right there. And I'm going to put that in the chat once I'm done with my little slide here. I don't want to go away from it, but you'll take a look at it. You'll be able to. It's a good starting point for a lot of the data that you'll need to fill those different tiers. It is local. It's by congressional district. It's by state, and it has. These are some of the categories that you could have that are in it. So talked about infrastructure. So it looks at HRSA level data, facility data, critical access hospitals and other hospitals, clinics, uh, skilled nursing facilities, and by congressional district. Again, looking at it from a rural versus non-rural categorization, depending on what the data source is. The workforce looks at MPI data, and we've grouped those classifications into the kind of the high-level ones of primary care, behavioral health, dental health, things that are very, very important when grant writing. So that information is in there. Shortage areas, we've taken that HRSA designated shortage area, and just made it a little bit easier to look at. We link back to the original source data, which has a lot more detail in it, but this is a quick way to kind of give an overview of your area and where those shortages are for primary care, mental health, and dental health. And then we've got about three different similar slides looking at health outcomes, health equity, and factors, and prevention, including all the things that you see here. So, kind of your top chronic diseases for health outcomes. Health equity looks at things like poverty levels, broadband, transportation, barriers, stuff like that. And the prevention looks at kind of screenings and mammographies and dental visits and health insurance. So things that are critical to that area. And what we've done is we've looked at those benchmarked against the state and the national average. So it's just important, kind of showing how that making that data work, as Jolene talked about. And then some other things that might be of interest are Medicare Advantage penetration, and then Medicaid enrollment by your congressional district. And then lastly, there is closed hospitals, which looks at the hospitals within your area that might have closed or converted, again, to prove that urgency of the access gap. So that's important to look at. And let me just go back here. I'm going to drop the.
I think they did.
Oh, they did. Oh, great. All right.
Yep, I think it's in the chat. Yep.
So feel free to take a look at that. And we actually did earlier today a presentation on that, kind of running through the dashboard.
Yeah.
All right.
All right. And yeah, thank you, Keith. And I can't stress enough, that really is a powerhouse of a data resource for anyone. It is one of the, I think, most powerful and most effective ways to start that data search. So please click on that link or capture that link so that you can click on it later and look through it, because I think you will be really impressed with it, and it honestly will save you a tremendous amount of time. But
If we
yeah,
just put in that was the kind of the goal too, was to have everything in one spot. Because I know as a data
yep.
analyst myself, it's very difficult to kind of find all the stuff that you need, and trying to
Yeah.
alleviate that for people. And it is free, and so yeah, have that.
And it is, yeah, it's free. We love
Yeah,
free.
yeah.
So in all fairness, I do have to talk about a larger map of the full data landscape, because we get the question all the time, like, where do I actually find this? So in addition to Stroudwater, which I'll mention a few more times in here, federal designation, that's your HIPSA, your MUA, P, your CA, your REH status. Start with Stroudwater. Get into RHI Hub. Get into the HRSA data warehouse. For community health indicators, those are your, prevalence rates, mortality, things like that. CDC places and county health rankings, those are your workhorses, and Stroudwater is also here to help. Demographics and equity, poverty, age, and all of that. The American Community Survey and census tools, internal operating data, EHR, claim system, things like that. This is consistently the most powerful layer, and sadly, it's the most underused. If your team isn't extracting that data proactively on a regular cadence, that is absolutely a project worth starting before your next application. You have to get in the habit of that. And for comparisons and peers, that RHI Hub, RUCA codes, you know, context. Sorry, you can also go to Stroudwater for that. Context is what is going to make your numbers really matter. So if I say a 28% RN vacancy rate is alarming, and it is, but if I say a 28% RN vacancy rate against a national rural average of 12%, that's a crisis that you can prove. So there's a difference there. All right, let's go on. So this is a reference card, right? What to pull and how to use it. And I hope you take it back and utilize it. That's the whole intention of it being in here. So what I'll add is the principle underneath it because that's sort of what separates like a data dump from a data case. Okay, every number in your proposal, it should have a job. Remember I told you your numbers need to be working constantly. That's the whole point of being in your application. You need to put those numbers to work, okay? Not just here's a statistic I found, but this one opens the need. This one shows the trend. This one ties the problem to the solution, okay? If you can't name a numbers job in your application, dump it, cut it. Reviewers, they're so tuned into this and they can immediately feel padding when you've put it in there. If that number is not doing its job and it's not being put to work, get it out of there. Okay, so let's watch how this works sort of across the table. We start with that access gap data, and that data isn't there to inform, okay? It's there to make the reviewer feel the distance before you've said anything else. So you lead with travel time and provider ratios, and by the time you describe your program, they already want it to exist. Your burden data does something a little bit different, okay? It shows trajectory, right? A number that is like simply bad, that's a problem, right? But a number that's moving in the wrong direction, that's a problem with momentum. And that is far harder to ignore. You see? So let's go down to outcome baseline. And this is one a lot of people they end up leaving it as static, and that's really unfortunate. You really want to take it and convert it into a target. So, like, we'll move X metric from Y to Z, measured by whatever your source is, and reported quarterly. So that move sort of turns a description into more of a commitment. You want to lead with the need, then you want to resolve it, and that's sort of like the whole discipline. So let's move on. We're going to dive into the narrative now. And it's interesting because narrative in this form, it's not decoration at all. Remember, I told you I came into this as a fiction writer and I thought I was so super. I was not. It's really not the soft part that you get to after the real work is done. This is the real work. This is the assembly because a proposal that can't be retold by a funder, by a reviewer, it can't be funded. So you have to think about what actually happens after a reviewer reads your proposal, okay? They walk into a funding committee, okay? And then they have to argue for your application over somebody else's. So what do they say? Well, if your proposal was just like a wall of data and compliance language, they say it scored really well on the rubric. And you know what? That might be enough. Sometimes it is enough. But if your proposal told a story with those numbers, if it gave them a line they remember, a number they can cite, a community that they can picture, they end up saying, well, this is the CA that's spending 380K a year on travel nurses, has a 94-day open position, Every single county in their service area is a primary care HIPSA. They have a specific plan. They've run federal programs before, and they know exactly what they're going to measure. Okay, do you see? The reviewer can repeat it, and if they can repeat it, they can advocate for it, and if they can advocate for it, they can win the room for you. So let's move on. So one critical bridge between data and narrative and something that's going to immediately improve the strength of your evaluation plan, it's the two types of metrics that you'll find in a grant proposal, and that's reach and that's impact. So reach metrics are going to tell you how big the effort is. Patients served, encounters, counties reached. These things matter, but they're not sufficient, okay? Your impact metrics, okay, these are going to tell you anything that's actually changed. So your reduction in avoidable ED visits, improvement in A1C control, costs avoided per patient. These are the metrics that reviewers are trained to look for. And these are the ones that often you'll find proposals just aren't delivering on clearly enough. So here's what that pairing kind of looks like in when it's put together. Your reach is we delivered 1,400 care management encounters to 250 patients with uncontrolled diabetes. But your impact is, and we improved A1C control in that group from 41% to 58% over the grant year. So the first sentence, right? We delivered 1,400 care management encounters to 250 patients with uncontrolled diabetes. That proves you did the work, okay? The second sentence, and we improved A1C control in that group from 41% to 58% over the grant year. Okay, that sentence proves the work mattered. So on its own, the reach number leaves the reviewer kind of wondering, but together they end up closing that loop before the question ever gets asked. So let's just do one more because it works in any type of domain. So the reach is going to be, we launched telestroke coverage across 3 rural sites and supported 140 emergency consultants. But your impact is going to be, and we reduced average door to treatment time by 19 minutes. So in stroke care, minutes are outcomes, right? So that second number is an activity. It's a patient who recovers at home instead of being transferred out. So you want to size the effort and then you want to prove that it mattered, okay? Reviewers aren't going to fund activity. They're going to fund change. So if your evaluation plan can only count things, you're not going to be able to compete against a proposal that can prove things. Every reach metric that you have has to be paired with an impact metric. Every output needs an outcome. That pairing, that's what closes the loop. And it's the difference between proposals that feel complete and one that leaves the reviewer with unanswered questions, which is not what you want to do. You want to make it as easy as possible for them. Let's go on. And let's get a little specific about language. So there's a category of grant writing I like to think of as like technically inoffensive, but it's also completely unpersuasive. And it sounds like this: will serve many residents, or this is a critical need, right? All of these sentences that are listed up here, they could have been written by any applicant in the country. Like none of them contain a single piece of information a reviewer can verify, score, or repeat to a colleague. So the translation becomes, will serve many residents becomes, will reach 1,840 patients across 4 counties in year 1. This is a critical need becomes, all 7 rural counties are mental health HIPSAs. ED behavioral visits rose 22% from 2022 to 2024. So in every case, the reviewer-ready version contains a number, a time frame, a specific commitment, and a verifiable fact. It gives a reviewer something to score, something to cite, and something to carry into committee. One more thing to note, you need to write to be read fast. Grant reviewers are scoring multiple applications under the deadline. Short sentences win, active voice wins. If a paragraph can be cut in half without losing meaning, chop it, get it out of there. Every word you make that reviewer work through, it's a small withdrawal on their goodwill. It just is. So you need to write like their time is limited, interestingly, because it is. Let's go on. So we're going to do a couple of these examples so you can sort of see where this theory comes into practice. So you can see where those data layers that we talked about combine with that reach and impact metric that we talked about and what that looks like on the page. So you can see what the weaker statement is here. And being honest, we've absolutely all written statements like this, myself included, and frankly, the statement is true. It's not a lie. The statement's not false, but it's also not strong, right? This isn't a writing problem, though. It's a framing problem. And the writer knows what they mean, but the reviewer doesn't. So it's generic, it's unverifiable, there's no scale, there's no proof, there's no urgency, right? The reviewer can't assess the problem size or measure or whether you've solved it. If you look at the stronger statement and you take a minute to read through that, you'll see there's I think six or seven data points in there, but it's only three sentences. That's it. But in those three sentences, it contains a federal designation, a geographic comparison, a time benchmark, and a trend line in three sentences, quick sentences. A reviewer reading that cannot say, I'm not sure this is like a real problem. You've you've removed the objection before they can even form it. Okay, that's a win. So let's go on. We'll do a couple more of these, and I am trying to speed it up. I am aware of the time. Um, so when we looked at that data stack, that layer, that very top was that access gap data. And I want to go back to that for a second because we remember we lead with access gap data, that HPSA status, as travel times, as provider ratios. I mentioned it then, and I'm going to say it again. You have to use this to open your need statement. Lead with it. Make the reviewer feel the distance before you tell them anything else. You can see the weaker statement here. You can read through their weaker statement here, and I'll tell you why it fails. Every rural applicant in the country can submit that sentence, right? There's no number, no designation to it. There's no distance to it. A reviewer can't picture where this is. They can't picture how bad it is. They can't picture whether it's better or worse than the application next to them. Okay. And then we move into the stronger statement, right?
Oops, sorry.
Um, that's okay. So let's, as we're reading through it, let's count. Let's count how many data points we're able to hit here. All five counties in our service area carry active primary care HPSA designation. The nearest primary care provider outside Arcot is 54 miles away, a 71-minute drive on roads that are impassable on an average of 23 days per year due to weather. Our provider to population ratio stands at 1 to 4 at 200 against a national rural benchmark of 1 to 2 at 500. That's 8. I'll tell you why it works. That reviewer now knows exactly where they are, right? You've put them exactly there. They know exactly how isolated it is. And they know now that that isolation isn't just geographic, it's seasonal and it's structural. You have made them without question, you've made them feel that distance before you've asked for a single thing. You've led with that. Thanks, Amy. I work with the nicest people. Um, so let's do another one. This is the last one we'll do on this. It's the second layer in that stack was that burden data, okay? That ED utilization, prevalence rates, maternal risk indicators, overdose data. This is that information that you want to use to quantify urgency and you want to show that trend direction. They love that. Remember what I told you. Numbers moving in the wrong direction are more powerful than numbers that are simply like bad, right? Because they signal that inaction has a trajectory. Okay. You can see the weaker statement here, and it fails because it has generic phrasing in here like high rates and frequently and growing concern. And while those things are true, right, they're not false, you're not lying, a reviewer can't score that. There's no trend, there's no comparison, there's no consequence of inaction. All it does is read like a description. It doesn't read like a case. So then if you take a moment and you read through that stronger statement here, it's incredibly effective because in that stronger statement, the trend line becomes the argument. Okay. A static bad number tells a reviewer there's a problem. Okay. But a worsening number tells them there's a crisis with momentum, and that momentum is the cost of inaction, right? That final sentence in here it lands this so explicitly, so no reviewer is going to have to draw the conclusion themselves. Remember, you don't want to make the reviewer work harder than they have to. You've done all the work for them. You've put them there. They know where they are. They're feeling it. You've done the work. So let's go on. So I'd like to know, where does your grant writing tend to break down the most? Is it your targeting, your data, your narrative? Maybe it's your pipeline. I'd be curious to know, is it in finding those right opportunities to pursue, building that data case, crafting a compelling narrative, sustaining the pipeline after submission? Yeah, finding those right opportunities. I feel you. That's why we have a scorecard in here. Building that data case. That's why we're giving you tons of data to work with. Crafting a compelling narrative. It's assembly, 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 assembly. Sustaining the pipeline after submission. That is like an art form. I hear you. Anyone else in there? Okay. So I would say, with that, with the with the narratives, right? That's consistent often with what you see in organization. And I think it's often left on the table because your data and your targeting, those are things that are like learnable and systematic. But narrative tends to be where a little bit more of that judgment lives, right? If when we're talking about building that data, good news, data is solvable, right? And now you have a better map. Um, what you want to start to learn and adopt is what to be doing with that data, which is what we reviewed uh, earlier today. So let's move on. So something to consider is that every winning proposal should have all five of these beats in some form somewhere in the narrative, right? If one is missing, it's going to be harder to close it. Your first beat is those stakes. So what's at risk if nothing changes? Like for whom and by when? And it's not like, oh, rural healthcare is important. Duh. What are you doing here if you didn't know that, right? You need to be specific. Who specifically loses what specifically if this program doesn't happen? Those stakes, that's what makes a reviewer feel that urgency before you've asked them a single thing, okay? That second beat is that specificity, okay? The exact community, the exact gap with rural specific data, okay? This is where all of your data stack work that we've talked through, that's where it starts to pay off. You've built that case, and now you're going to weave it into that story. You're going to make those numbers work, right? So that they read as a narrative. You do not want to just have them in there as a data appendix. You are going to put them to work. That third beat is your strategy. That's your theory of change. So, why this intervention? Why now? Why this approach over another one? Reviewers who read hundreds of proposals, they're so skilled and they can tell the difference between a strategy that was like reverse engineered from a notice of funding or an RFP and one that came, I think, from like genuinely thinking about what will actually work. If I tell you anything, it's be the second kind. Be the second kind. It reads completely differently. And they're also intuitive about it. They can tell. Beat four, that's your standing. Why your organization? Why your track record, your partners, your community relationships, your capacity to execute. So this is where you answer those reviewer like unspoken questions. Can they actually pull it off? Okay. Don't make them wonder. Answer it directly and with full confidence, like with your full chest. Answer that. And that fifth beat is that sustainability. What happens after the grant ends? This is the beat that a lot of organizations will often they write it last, and so they end up writing it the quickest, and therefore it ends up being the least convincing, right? But it can really make or break a technical review. The investment thesis closes that loop. A reviewer funding a 3-year program needs to believe the work continues in year 4. So do them a favor, just show them that path specifically. So let's go on. So the next couple of slides that I'm going to show you as we wrap up. This really is the goal is to try to help you develop a strategy for a 12-month grant pipeline that could be useful for a small team or an individual person. But I also understand we are also all we're all doing a lot more than we realize, and it doesn't necessarily make it a perfect fit for everybody, but hopefully there are pieces from it that you can take and that will help alleviate some of the work for you. So let's move on. And I'm going to spend a little bit of time on this one while keeping time on the clock because I find this really important. And if you are somebody that works on a small team, and if you are somebody that is working as the sole grant writer for an organization, I truly believe in this, and I truly believe that this can help you get to where you want to be without ripping your hair out. So let's talk about the logic model. It's not the most exciting part of a grant application, but I sincerely believe it's one of the highest return things that you can build. If you are unfamiliar with logic models, okay, it's a visual roadmap. It shows how your resources connect to your activities, and it shows the results that those produce, and it shows the long-term change that you want to see. So for reviewers, it's like a proof of concept. It moves you sort of from a vague, like, we'll serve a lot of residents, to a defensible strategy that shows you know exactly how to move that needle. So it's six building blocks flowing left to right, plus that one row underneath. It's your inputs, what you start with, your activities, what your team does, your outputs, countable products, your short-term outcomes, first changes sort of in knowledge or behavior, like 6 to 12 months. Your intermediate outcomes, midterm shifts in practice or policy, like 1 to 2 years. Your long-term outcomes are the big systemic impacts. And underneath it all, you'll see there's an assumptions and external factors. What you're counting on, workforce, reimbursement, broadband, weather, things like that. So why do you want to bother with something like this if it's optional and you don't have to do it? I'll give you two reasons. And the first is that it forces you into finding the holes before a reviewer does. If you can't fill in that intermediate outcomes column, then you don't actually know what change you're driving toward. You need to find those gaps now, and you need to find them before you submit. So this is going to help you do that. Second, it ends up writing half of your evaluation section for you. So those outcome columns, those short term, that intermediate, that long term, those are your impact metrics. So this is going to help you get there. Quick note on the assumptions. You got to name them out loud in the application because reviewers will ask. And the applicant who's already named them, has named the risk, reads, I think, far more credible than the one who just doesn't consider them. So let's take a second. Let's make this a little more concrete. And I do want you to know I have put a blank logic model as a worksheet for you at the end of this that you'll receive as a PDF. Um, let's take the grant jargon out of it for a second. Let's just get super basic with it. So picture a small rural county, right? Lots of folks there have diabetes, but the nearest specialist is 2 hours away and the local clinic is short-staffed, so people skip appointments. They end up in the ER when things get bad. You want to fix that. So a logic model is just you explaining step by step how money turns into healthier people. It reads left to right like a chain. So your input's going to be what you start with, right? Grant money, a nurse, clinic building, internet, partnership with a local pharmacy. Your activities are going to be what you do with it. You run video appointments so people don't have to drive 2 hours. You train a community health worker to check on patients at home. Your outputs, the countable proof that you did the work. 200 video visits done. One health worker trained. 150 home check-ins. Here's the catch. Outputs only prove that you showed up, okay? Doing 200 visits doesn't prove anyone got healthier, right? So you have to remember that. So the next three boxes, that's where real change happens. They're building on each other. So in the short term, patients actually understand their meds and they start checking their blood sugar. Amazing. Intermediate, because of that, more people keep their diabetes under control, stop missing appointments. The long term, that's the dream, right? We got fewer ER trips, fewer serious complications, a measurably healthier county. Amazing. So it operates like one long if-then sentence. If we have money, a nurse, and internet, and we run video visits and home check-ins, then patients manage their conditions better. which keeps them out of the ER, which makes the whole county healthier. Then underneath, you have those assumptions. What you're counting on but can't fully control. Things like that the internet's going to stay reliable, that patients trust the health worker, uh, that the clinic can keep the nurse on staff. Smart people can name those out loud instead of pretending that they don't exist, and that's exactly what you want to do. So that's the whole idea of a logic model. The funder's essentially saying to you, if we hand you this money, walk me through how it turns into something that changes people's lives. So this logic model is that walkthrough. It's proof that you've thought it all the way through. So let's go on. We're almost there. So everything we've talked about today, targeting, discipline, data infrastructure, narrative craft, it's only powerful if it operates consistently. And I know how hard that is when you are working with limited resources. Um, so here's a quarterly rhythm that you can consider that can often work well for a smaller team or a team of one. That Q1, you want to plan. Let's refresh those strategic priorities, score those live opportunities, right? Build a data refresh calendar, right? You want to pick 3 to 5 priority pursuits for the year, not 12, 3 to 5. In that Q2, you want to pursue. Get busy cultivating those relationships with program officers. Draft those core narratives in modular form. Well-built community needs section can move across multiple applications in the same genre with targeted adjustments. So get yourself in that position. Submit federal apps. And here's a discipline that consistently separates winning teams from reactive ones, and that is that you need to start preparing yourself to decline inbound notice of funding or RFPs if they're the wrong opportunities. You have to remember to protect your bandwidth and give yourself the time and energy for the right ones. Um, and the last is, well, the quarter three, you're going to work on your position, your site visits, your funder briefings. You're going to refresh your year two logic. In Q4, you're going to work on proving outcome reporting dashboards, renewal planning, multi-year strategy. So the goal of this is rhythm. You don't want to keep starting at zero. Okay. You want to keep yourself prepared. We have one more slide and then we'll wrap up. So if you leave with nothing else, I mean, I hope you're leaving with something. Um, you got to stop writing proposals and you got to start building cases. A proposal asks for money and a case makes funding you'll feel like an obvious decision, right? Everything we've covered, disqualifying ruthlessly, leading with rural specific data, pairing reach with impact, the logic model, year-round relationships. It's a service. It's just one shift, right? Teams that are consistently winning, they're not the best writers in the room. They're the ones who decided on purpose to compete in fewer races, right? And they show up to each one already in that relationship with that data, knowing the story. So you can absolutely take this information, you can go out and you can build your case. So that's the end. We do have at the end of this, which you'll receive a couple worksheets for your use. We have a go, no go framework that we talked through. That's a scorecard, a need statement builder, and the last one is that blank logic model. And then at the very end is Keith and I's information.
Thank you, Jolene. I know we had some technical difficulties up at the beginning of it,
It's
and you have
okay.
pursued through it. So,
I appreciate
thank you for
everyone for
that.
hanging in.
Yep. So we did have a few questions that came through the Q&A box. We don't have time to answer those today, but Jolene will be answering them afterwards and sending that out to everyone. This concludes day 4 of the 2026 COB Virtual Conference. Thank you for spending your day with us and your continued commitment to serving rural communities across the country. Today's conversations focused on several areas that are becoming increasingly important to the future of rural healthcare, including data-driven planning, physician succession strategy, advocacy, and long-term funding sustainability. Across each session, we heard practical examples and real world perspectives from leaders working directly alongside rural healthcare organizations and communities every day. As a reminder, when you close out of today's session, you will receive a brief survey pop up. We truly appreciate your feedback, and it should take less than 1 minute to complete. We hope you continue the journey with us this week as we share additional practical strategies and operational insights focusing on strengthening rural healthcare organizations and the communities they serve. Thank you again. We'll see you tomorrow for this. So be looking for emails from us and see you tomorrow.
Thanks, Amy.